Over the last week, USA Today published an attack on Medicare for All by someone known as, who is this? Current President of the United States, Donald J. Trump. Now, the article itself is titled, Democrats' Medicare for All plan will demolish promises to seniors, and in the subtitle, he argues the Democrats want to outlaw private healthcare plans, taking away freedom to choose plans while letting anyone cross our border. We must win this. Okay, so by just looking at the title, I already have a number of issues. This is going to be long. It's going to be a really long video. First of all, are we really supposed to believe that Donald Trump took the time out of his day to stop watching Fox News and write an article? Don, I've seen your tweets. This doesn't match your writing style. Even though, it's not the best ghost-written article in the world, it's clear that it's not Donald Trump. There's no caps. I mean, half of this would be in all caps if it were Donald Trump. He'd end sentences with sad exclamation and whatnot. So this isn't Donald Trump, right? Now, in the title and subtitle, there's numerous things that stand out as being obviously false. So I want to address that first. So if he claims it's Democrats who would harm Medicare, good luck convincing the public that it's not your party who actually wants to, quote, demolish Medicare, because right after your party passed tax cuts for the rich, Speaker Paul Ryan proposed cuts to Medicare in order to fund tax cuts for the rich. And if you think that that example goes too far back, then I've got one from October 16th of Mitch McConnell saying that it's going to be really important for the party to cut programs like Social Security and Medicare in order to solve the deficit crisis that they created. Now, Trump also says that their plan would outlaw private healthcare plans. That's just factually incorrect, even if I think it should outlaw private healthcare plans. Now, he also claims that this plan will incentivize undocumented immigrants crossing the border. Now, let's just be extra kind to Donald Trump here for argument's sake and assume that having Medicare for all will in fact attract undocumented immigrants. So are we supposed to not guarantee healthcare for every single American because you and your sycophantic xenophobic supporters don't like the idea of immigrants coming into the country? We're supposed to say, okay, well, you got me there. We can't have immigrants wanting to come into the country, so I guess we probably shouldn't have Medicare for all, and we should make the country as shitty as possible in order to dissuade others from coming in who we don't like, who are brown. I mean, fuck out of here. What a stupid argument to make. How is that going to persuade anyone? By Trump's logic, we wouldn't have paved roads, we wouldn't have a fire department, we would make this country shittier in order to make sure that nobody would want to come here. And it's an absurd stand to take. And he also says we must win this. Well, guess what? You have the plan you want currently. So long as the status quo doesn't change, you win. You win by default. We don't have Medicare for all, and that's what you want, so you are winning. So, I mean, look, there's so much in this article that I take issue with that it would honestly, I honestly considered going sentence by sentence and breaking that down, but that would just take me forever. So I'm just going to isolate certain portions of this and talk about why they're not only intentionally disingenuous and misleading, but flat out wrong. And he even links to some articles to validate his point that prove him wrong. So the first paragraph I want to get to here, he states, dishonestly called Medicare for All, the Democratic proposal would establish a government-run single-payer healthcare system that eliminates all private and employer-based healthcare plans and would cost an astonishing $32.6 trillion during its first 10 years. Now, first of all, I don't understand how he can do mental gymnastics to the point to assert that Medicare for All, calling it Medicare for All, is dishonest. That's literally the point of the fucking program. We take our current Medicare system that everyone loves, improve it, expand it to everyone, and it's Medicare for all. Nobody's left behind. There's 100% universal coverage. Healthcare will now be free at the point of delivery under the system. How is it dishonest to call it Medicare for all? I mean, it makes no sense. But he cites that $32.6 trillion statistic, and he links to this. Now, can you guess what study he's linking to validate his point? Well, of course, when you click that link, it takes you to the Koch-funded study by the Mercatus Center. What a surprise. Now, first of all, he's not going to tell you that in that same study, it actually shows that, by and large, Americans would save $2 trillion. He's not going to tell you about that portion of the study because it doesn't prove his point. But when he says that Medicare for All would cost $32.6 trillion, that's such a disingenuous, misleading way to frame it that he's just straight up lying. I don't know how else to describe it, because $32.6 trillion, that's the increase in federal spending needed to cover Medicare for All. It's not the total cost of Medicare for All. Our current system costs about 59 point something trillion. We'll just say 60 trillion for argument's sake. But Medicare for All is $2 trillion less than that. And if you increase federal spending by $32.6 trillion, and that's a very, very conservative estimate, there are other studies that say it's a lot less than that, sometimes even half than that. But if you say that Medicare for All would cost $32.6 trillion, what he's hoping you'll take away from that is that the government is going to have to raise $32 trillion in order to pay for Medicare for All. But that's just not true. The government is already spending trillions of dollars on healthcare every single year. They're paying for the Affordable Care Act, the Children's Health Insurance Program, Medicaid, Medicare. They're providing private companies with government subsidies. And we'd simply take the money that we're already spending on healthcare and put that towards Medicare for All. And when you do that, slightly raise taxes, and once you account for all the savings associated with Medicare for All, it's not that difficult to fully fund it. So he says Medicare for All would cost $32.6 trillion. No, that would be the federal increase. So we can't afford not to have Medicare for All because we pay more for worse results compared to other industrialized nations. And furthermore, under Medicare for All, individual families would save thousands of dollars every single year if we moved to this system. So he's trying to fearmonger by being disingenuous about Medicare for All when he clearly doesn't know what the fuck he's talking about, and it's just infuriating. Now, I do want to get to the next paragraph that I take issue with. So he states, as a candidate, I promised that we would protect coverage for patients with pre-existing conditions and create new healthcare insurance options that would lower premiums. I have kept that promise, and we are now seeing health insurance premiums coming down. Now, let's just take a moment here to humor him and follow the links that he provides you with in order to validate his claim. So if you go to the link where he says that he vowed to protect patients with pre-existing conditions as a candidate, well, that takes you to a Washington Post article where they actually attack Trump. It's titled, President Trump's Flip-Flop on Coverage for Pre-Existing Health Conditions, and it literally explains how his administration is now arguing in court that the provision in Obamacare that protects patients with pre-existing conditions is actually unconstitutional. But to his credit, if you go further down the article, it does state that he did vow to protect pre-existing conditions as a candidate. But I mean, for the most part, the crux of the article is this author shaming Donald Trump for flip-flopping on wanting to protect patients with pre-existing conditions. So this is an incredible cell phone, and I can't believe that he actually linked you to this article, which is further evidence that this was not Donald Trump that wrote this article. I think this has got to be a staffer that linked to this to troll him. Why would you link to an article to prove your point only to find that that article attacks Donald Trump? Justifiably so, mind you, but it does attack him nonetheless. I mean, I can't believe he linked to that. I was laughing when I first saw that. So obviously, since his administration is currently arguing in court that pre-existing conditions are unconstitutional, meaning that they're against it, then that means that he violated his promise and his party does not want to protect patients with pre-existing conditions. And I didn't even get to the vote last week where the Republican Party actually voted to kill a bill that would have protected people with pre-existing conditions. So clearly, they're against helping people with pre-existing conditions. Now, he also makes the claim that insurance premiums are coming down. Now, that's odd because, what's the evidence for that? Because everything that we've seen thus far shows that insurance premiums are increasing under Donald Trump. Well, if you follow his link again, it just takes you to a quote from HHS Secretary Alex Azar saying that they're going to come down in 2019. Well, that's not evidence. You said in this article that insurance premiums are starting to come down, and then as evidence, you link to your HHS secretary saying, oh, they're going to come down in 2019. Someone saying something is not evidence that that's actually happening. You can actually talk to Americans and ask them, hey, how much has your monthly health insurance premium increased since Trump took office? And most likely they'd tell you by quite a bit. The reason why he couldn't provide you with evidence is because insurers are warning that monthly healthcare premiums will likely increase in 2019, even if Donald Trump is wanting you to believe that they're going to come down. And this is because Donald Trump suspended a subsidy to insurers. So that's why they're going up. Also, employer-sponsored health insurance is also expected to rise in 2019, and substantially so, mind you. So, I mean, we've gotten 2 paragraphs in, I've read you the title, and it's already riddled with factual errors. Now, getting to another paragraph. I also made a solemn promise to our great seniors to protect Medicare. That is why I am fighting so hard against the Democrats' plan to eviscerate Medicare. So this is a go-to Republican tactic. We say something, and then they say that we said the opposite of that. If something is true, they'll say the opposite is true in order to move the argument in their direction. We say we want to improve and expand Medicare for all, and he says, oh, well, you must want to eviscerate it. I mean, unbelievable. What he's thinking about is maybe the Republican Party who wants to eviscerate it, because let me remind you again, Mitch McConnell is introducing a plan to cut Medicare and social programs like Social Security. It's not Democrats who are proposing this, it's Republicans. Now, getting to a longer paragraph, there's a lot here. He states, the Democrats' plan means that after a life of hard work and sacrifice, seniors would no longer be able to depend on the benefits they were promised by eliminating Medicare as a program for seniors and outlawing the ability of Americans to enroll in private and employer-based plans. The Democratic plan would inevitably lead to the massive rationing of healthcare. Doctors and hospitals would be put out of business. Seniors would lose access to their favorite doctors. There would be long wait lines for appointments and procedures. Previously covered care would effectively be denied. So literally every single sentence of that paragraph is a lie. It's completely a lie. It's factually incorrect. So Medicare for all would reduce your choices. You wouldn't be able to see the doctor that you want to see. Well, let me ask you this. If you try to see a doctor or a particular specialist that you need to see who's outside of your insurance network, what's going to happen? You're going to have to pay that cost out of pocket. And the cost of healthcare is so high that you're just not going to be able to see the doctor you want to see. So there's actually less choices, contrary to popular belief, under our current private healthcare system. He also claims that, oh, well, these seniors are going to be, they've been paying into this and they're not going to get the benefits. That's the underlying implication. No, they're going to get more benefits because now Medicare, the program that they're all on, would be expanded so it includes dental, vision, it would cover their hearing aids. So if you're a senior, you shouldn't be concerned that more people will be on Medicare for all. If you're truly a self-interested individual, you should be pushing for Medicare for all alongside all of us, because that's going to make Medicare better for you as well. And when he says that doctors and hospitals would be put out of business, that doesn't even make sense. When he says that this would lead to rationing, all healthcare systems, they ration. We would ration based on need as opposed to how much you can pay. This is a point that Kyle Kalinske brings up all the time to his credit, and it's such a great point. We're already rationing. We're rationing now based on money, but if we move to Medicare for all, we'd ration based on need, which is something that is reasonable because it's a healthcare system. If somebody needs a procedure and they need it quickly, then they'd move up to the line. And he talks about wait lines. That's just not true. You can look to Canada, the UK, any type of modern industrialized nation with a single payer or universal healthcare type system. They're not waiting any longer than we wait. That's such a ridiculous talking point. So he basically just made all of that up to fearmonger and lie to you in order to scare you into thinking that, Medicare for all would be bad for you. And look, voters are self-interested, and a self-interested individual is most likely going to be averse to things that change things up substantially, right? So most people, most voters specifically, fear change, and he's playing on that. Now, I don't think he knows strategically that that's what he's doing, because I don't think he's that bright, but that's exactly what's happening here. He also states, in practice, the Democratic Party's so-called Medicare for all would really be Medicare for none. Under the Democrats' plan, today's Medicare would be forced to die. Again, the opposite of what he's saying is true. Medicare for all would really turn into Medicare for none. But everyone would have it. So what are you saying? More people would have it. Everyone in the country would have it. That doesn't make any sense whatsoever. Under the Democrats' plan, today's Medicare would be forced to die. No, it would be given new life. It would be expanded. It would be healthier than ever. So what is he saying? The only thing I could possibly gather based on his previous xenophobic arguments is that, well, if we get Medicare for all and all these undocumented immigrants cross the border and they seek out healthcare treatments, then that's going to bankrupt the system. Well, why don't you ask Canada whether or not their single-payer system turned into Medicare for none? Ask them how little people are getting Medicare. They're going to laugh in your fucking face. Ask them how many people are dying and going bankrupt due to a lack of health insurance. They're going to laugh in your fucking face because that doesn't happen. Last paragraph I'm going to get to here. The truth is that the centrist Democratic Party is dead. The New Democrats are radical socialists who want to model America's economy after Venezuela. Of course, he'd bring up Venezuela, because why would you cite what we actually want, which is, a model akin to Scandinavia? But what he's saying is factually incorrect. Centrist Democrats are still in control. They hold leadership positions, and even supporting the position of Medicare for all, that doesn't necessarily mean someone is far left or radicalized. This is a fairly moderate stance, at least internationally. When you go to the UK and you ask conservatives, party members and voters, how do you favor getting rid of, your national health system? They'd tell you, of course we don't. Are you crazy? If you ask your own party in the US, Trump, more than half of them now say they support Medicare for all. So to push this idea that it's radical, well, your party must be radical as well. It's completely absurd. And what Trump is doing here is he's making a value argument. He's saying that the tax dollars we're already spending, it shouldn't go towards helping us. It should go towards killing people. Wars, in the Middle East and North Africa, we can spend as much money as we need to on those. But when it comes to healthcare, we just don't have the money. So anyone who makes this case so strongly, and Paul Ryan did the same thing. He recently came out against Medicare for all and spoke out against it by basically just lying through his teeth. Anyone who's doing this, blood is on their hands. They are complicit in a predatory, for-profit system that leads to the death of civilians. And so long as they don't act, their hands get more and more covered in blood, and they don't even care. So this was such an idiotic attack on Medicare for all, and it certainly was one of the most disingenuous attacks I've seen on it yet. But the fact that he's attacking Medicare for all, it is kind of a good sign, if you can believe that, right? Because we're gaining so much momentum in the battlefield of ideas, as someone like Dave Rubin would say, because they wouldn't feel the need to come out and attack Medicare for all so vociferously if they didn't think there was a chance it'd be passing. A year or two ago, it wasn't on their radar. They didn't care about Medicare for all, but now that their own party is starting to cross over to our side and agree, yeah, this program kind of makes sense, now they're scared. So the fact that Trump and Republicans are going out of their way to attack it is just evidence that we are winning this battle.
Support this podcast by becoming a patron at patreon.com/Humanist Report.